employers that are facing the individual and employer mandates in 2015. A couple of housekeeping items. First of all, a few disclaimers. This presentation is not meant to be legal advice, is not meant to be tax advice, is not meant to be the final word on healthcare reform, which is ever changing, and is also not meant to be a political opinion of any kind. I am your host, Wes Campbell, Vice President of Structured Employee Benefits of Ohio, or SEBO, since 2002. I'm a charter benefits consultant. My job is to work with our customers on implementing their long-term strategies, as well as reviewing new products and information that's available in the marketplace. We will be doing additional webinars throughout the rest of the year, so please make sure you are staying in touch with us via our website, which you can see the address there. Also, you can find us on all available social media sites, Twitter, Facebook, and Google+. This webinar will also be recorded and uploaded to our website so that you may reference it in the future at any time. So what's on our agenda for today? Well, first of all, we're going to talk about a cost-effective minimum essential coverage option that we think can be a good strategy for those that are worried about providing coverage to their employees who have not been benefits eligible in the past, in lieu of facing severe penalties. And then we'll briefly touch on some large employer reporting mandates that are coming up starting next year. So what are the penalties that employers face as we move forward? And they basically can be broken down into two categories. The first question you have to ask yourself is, do you offer coverage to your full-time employees, those that work 30 hours? If you do not offer coverage, you open yourself up to the $2,000 employer mandate penalty. That penalty, which begins in 2015 for employers with over 100 full-time equivalents, employers will be granted a credit for the first 80 employees. So if you have 100 employees, you get a credit for the first 80. So that's 20 employees at $2,000 penalty. That's a $40,000 penalty. So the first question is, do you offer coverage? And then the second question is does that coverage provide minimum value? And is that coverage affordable? By minimum value, we mean, does it provide at least an actuarial value of 60% to the employees, which is a bronze level plan by the standards set up within the Affordable Care Act? And then is that coverage affordable? It can't cost any employee more than 9.5% of their household income. If you do not provide minimum value or you do not provide coverage that is affordable, you trigger the $3,000 penalty, which is only incurred each time an employee, a full-time equivalent, or full-time employee, excuse me, receives a subsidy in the exchange, and that would trigger the $3,000 penalty per occurrence. So the $2,000 penalty happens for not offering coverage, and that happens based on the total number of employees minus a credit for the first 80 in 2015, which will go to 30 in 2016. And then the second question is, do you provide coverage that has minimum value or is it affordable? And that triggers the $3,000 penalty, which only happens per occurrence, not on the total number of employees. So what is the plan that we have in place to help satisfy this situation? Well, it's difficult to provide an affordable option that solves both questions, both the $2,000 penalty and the $3,000 penalty. But we do have a very cost-effective option which satisfies the $2,000 employer mandate penalty and also absolves the employees of the individual mandate. And we can do that by offering what we call the essential plan offered by Reliance Standard. As you can see in the text here, beginning in 2014, the Affordable Care Act will require citizens to maintain minimum essential coverage. And that's exactly what this plan is going to provide. Minimum essential coverage includes health insurance coverage provided by government-sponsored plans, by employer-sponsored plans, and also Medicare and Medicaid. The Affordable Care Act also extended coverage to dependents up to age 26 and required that health insurance plans to cover preventative services without any cost sharing, meaning that preventative services are covered 100% with no annual or lifetime limits. In 2014, failure to do so by an employee, by an individual, will result in a penalty of $95 per uninsured person or 1% of the household income. That number is going up dramatically in 2015. Beginning in 2015, the Affordable Care Act also requires that employers with over 50 employees offer their full-time employees the opportunity to enroll in group health coverage, which provides this minimum essential coverage. Failure to do so is what triggers the $2,000 penalty, which will be implemented moving forward. As you take a look at this essential coverage, you'll see that it provides preventative care and contraceptive services only. So it only meets the minimum essential coverage parameter. It doesn't provide minimum value, and it doesn't provide, it is affordable based on how it's set up, but it does not provide minimum value. Coverage on this policy is available to employees and their spouses and children all the way to age 26. This essential plan is basically a simple and affordable way for employers to offer minimum essential coverage to their employees so that they are satisfying the employer mandate and the employee is being covered under the individual mandate. Under the summary on the right, you can see that preventative care is covered for no copay and no deductible with no annual or lifetime maximums. So employees enrolled under this plan will be given total access to preventative services under the U.S. Preventative Services Guidelines. There's a few things listed below as to what is covered. Well child exams, physical and behavioral assessments, immunizations like diphtheria, tetanus, and pertussis, and then screenings for things like hearing loss, lead poisoning, depression. For adults, annual preventative care visits are covered. Immunizations like hepatitis and influenza, general health screenings for blood pressure, cholesterol, and diabetes, as well as prescription contraceptives for women. There is a $50 copay for brand name contraceptives. So if you're taking, if the employee is taking something that's not considered a generic contraceptive, there's a $50 copay. You can see what the monthly costs are for this minimum essential coverage. $40 per employee, $63 for employee plus spouse, $80 for employee plus one child, $124 for employee plus children, and $144 for full family. Under this plan, employers are required to pay all of the $40 employee-only cost. The employer is not required to contribute anything to spousal, child, or family coverage. So you can see employer must contribute 100% of the employee-only cost. This plan must also be offered in conjunction with Reliance Standards Basic Advantage plans, which we'll talk about in a second. These monthly costs are outlined above, are subject to change for groups with more than 500 or groups that have an average age greater than 40. So essentially what this does is by offering this plan at $40 cost per employee or $480 a year, offers employees the chance to have preventative services and immunizations covered 100% where they may not have access to that currently. And at $480 over the course of the year, that is far less than the $2,000 penalty. Now, we'd have to look at everybody's case-by-case scenario to see how the pay or play will affect them. But we think this is a cost-effective option for at least meeting the minimum essential coverage parameter of the employer mandate and the individual mandate. And these rates are guaranteed for at least 1 year, although we don't expect them to change moving forward much at all. As I mentioned, Reliance Standard requires the employer to pay the employee-only cost, which is $40 per employee. This does not include any administrative costs for Structured Employee Benefits of Ohio for implementing this plan, and we can discuss that as we move forward for those that are interested in implementing this. There are no commissions or administrative fees built in to these rates. I also mentioned that Reliance Standard requires that this plan be offered in conjunction with their Basic Advantage plan, which is their limited benefit medical plan. Here we can see page 1 of the 8 limited benefit plans that Reliance Standard offers. These types of plans, again, do not, even by offering this, it does not constitute minimum value. It still would open an employer to the $3,000 penalty, even if somebody enrolls in both the Essential Plan and this Basic Advantage Plan. If they were to still go into the marketplace and qualify for a subsidy and enroll in coverage, that would trigger the $3,000 penalty. But our thought behind this is that employees having access to the minimum essential plan and then the possibility of also enrolling in this Basic Advantage plan, which is far less expensive than traditional insurance, will probably negate many people going into the exchange and purchasing coverage with a subsidy. This Basic Advantage plan includes a number of benefits, including inpatient hospital benefits such as hospital room and board, hospital admission, and surgical benefits. You can see, for example, the room and board ranges from $100 a day under Plan 1 to $1,000 a day under Plan 8. The accident benefit for admission to the hospital ranges from $1,000 per incident under Plan 1 to $4,000 on Plan 8. The surgical benefit ranges from $500 to $2,000. There are also outpatient benefits, such as a doctor office visit. For example, on Plan 1, the daily benefit for a new patient office visit is $75, and that's limited to one per year. That goes all the way up to $100 under Plan 8. There's also additional benefits for, say, an emergency room visit, ranging from $50 a visit to $100. There's also radiology benefits on an outpatient basis. So it does provide benefits for those that are receiving treatment via radiology. On page 2, there are additional outpatient benefit categories, such as pathology, meaning lab work for employees that are receiving, say, routine blood work, ranging from 2 benefits a year at $40 value, all the way up to 5 lab works a year up to $50 in value. There are also wellness benefits, including mammogram screenings, prostate and cervical cancer screenings, as well as additional emergency room visit benefits, outpatient surgical benefits, and prescription drug benefits. You can see with the prescription drug benefits, under Plan 1, only generics are covered for up to 7 scripts per year, up to $25, whereas on Plan 8, someone can qualify for up to 48 scripts per year at $25 value on the generics, $50 on name brand drugs, and that's limited to 12 name brand drugs over the course of the year. All of these plans also include several non-insurance services like a vision discount card, access to the multi-plan provider network, meaning that subscribers who adhere to the multi-plan network will receive deep discounts for their services. There's a 24-hour nurse line. There's an online wellness portal, and there is a one-call travel assistance program included as well. And you can see what the cost ranges in on a weekly basis, both on a from a voluntary standpoint, as well as for those that may want to provide an employer contribution. So the weekly cost on Plan 1 ranges from $12 a week on a voluntary basis to $36 a week for Plan 8 on a weekly basis. So again, typically what we do is, based on the salaries that your employees are currently being offered, we will help you pick which one of these plans is the most affordable, but also will provide the most bang for the buck to the employees. Now, typically, we only offer one plan in conjunction with the minimum essential coverage plan. Reliance Standard does require that this Basic Advantage plan be offered in conjunction with the minimum essential coverage, as I mentioned, and they do require that at least 10 people enroll in this Basic Advantage plan. So whether or not that will determine whether you offer it on a voluntary basis or whether you offer it on a 50% employer contribution basis will be up to you, and we will help guide you through that process. But at the end of the day, we think offering this minimum essential coverage with this Basic Advantage plan is still a very cost-effective option versus paying substantial penalties. Again, it doesn't absolve the employer of all penalties. It does absolve the employer of the employer mandate, the $2,000 penalty, but even if somebody participates in both of these plans, if they do qualify for a subsidy and elect to enroll in a plan through the marketplace, that would trigger the $3,000 penalty per occurrence. Some of the benefits, again, to the Reliance Standard limited benefit products does provide the minimum essential coverage, as we've mentioned. So it does satisfy the Tier 1 $2,000 penalty, and it absolves the employees of the $95 penalty or the 1% of their household income moving forward. The employer is required to contribute 100% of the employee costs to that minimum essential coverage plan. And then the employer is also required to offer one of the 8 fixed indemnity limited benefit products that we just talked about. It can do so either on a standalone basis or with the minimum essential coverage. Reliance Standard and CBA will provide customized employee brochures. Enrollment can be done via paper or telephonic. And we can also do an electronic census for takeover cases, so if you have something similar in place. There's also web-based enrollment, which we find very handy, given that many of you have multiple locations with different staffing needs. Employees will also be provided a summary plan description, which is part of the law as well. Employees will get the benefit of having an ID card and having a network if they enroll in the Basic Advantage plan, and that will be sent directly to their home. Reliance Standard also provides dedicated member services and a claims staff, so employees will not only have full access to the staff here at CBO to help them with any claims issues or enrollment issues, but they will have a dedicated service department at Reliance Standard as well. They do have a state-of-the-art claims processing and payment department, which includes 100% HIPAA privacy. They do provide high-speed scanning of medical records. Their claim form is designed to achieve a 90% auto adjudication rate with a 3-day turnaround time. So claims are processed very, very quickly by Reliance Standard. And their member services and claims staff are all accessible through a toll-free number. Again, we would suggest that employees that are enrolled in these products contact us first and foremost for any service-related issues. This just kind of recaps the products that are available through Reliance Standard. We talked about 2 of the 3 today, the Essential Plan in the green, and then we also talked about the Basic Advantage plans in the blue. And those can range in cost from $11 a week to $40 a week on a pre-tax basis. Now, they also do have the Essential Plus plans, which provide the minimum essential coverage, but also beef things up to include inpatient hospital admissions, surgical benefits, emergency room benefits, prescription drug benefits. Those can get a little more expensive, and we can talk about those on an as-needed basis. Now that we've talked about what we think is a cost-effective option for employers moving forward. We also want to make sure that we highlight some of the compliance issues moving forward for employers. Large employer reporting is a large part of what is coming in 2015 with healthcare reform. So starting with health coverage as offered in 2015, meaning that the reporting will be done typically in the beginning of 2016, employers with 50 or more full-time employees and or full-time equivalents must provide the IRS and their employees information about the coverage offered during any given calendar year. The 2015 reporting is first due in early 2016 in tandem with other tax filing documentation. The information will confirm the employer's compliance with the employer mandate. So again, if we are offering the essential coverage, that will be reported to the IRS so that an employer will not be penalized at $2,000 per employee. Whether the employer offered all full-time employees and their dependents the opportunity to enroll in the minimum essential coverage, and each full-time employee's required contribution to costs will be included in this information so that it will be determined whether or not this provides minimum benefit. Not, but again, that penalty is only triggered if somebody goes into the exchange and receives a subsidy. Also starting for the plan year 2015, so in early 2016, will be minimum essential coverage reporting. A lot of this will be handled by the insurers and employers who self-insure their group health plans. Will provide to the IRS a list of the covered individuals and information about the minimum essential coverage. This information will confirm each person's enrollment for each month of coverage as required by the individual mandate. So this large employer reporting will help the IRS track the individual mandate. This reporting is required by employers of all sizes. This again will start in early 2016 for the plan year 2015. The type of data that they will be requiring includes the name and address and the EIN of the reporting entity, name and address and the Social Security numbers of the individuals, name and Social Security numbers of those that are covered, so including spouses and dependents, and the months of coverage during the calendar year. If you are interested in learning more about the minimum essential coverage or the limited benefit options through Reliance Standard, or you have concerns about your reporting needs beginning in early 2016, feel free to contact us at any time. That's what we're here for, is to help you navigate this ever-changing landscape of healthcare reform. If you are interested in looking at group insurance quotes as well, we can provide those as well. Many of you already have your insurance benefits administered through CBO. To provide you with a quote, all we need is your group name and tax ID, a copy of your current benefits and plan summary, or if you don't have some, what you're looking for, a copy of your current bill if you have benefits in place, a copy of your most recent renewal, a completed application, an employer risk assessment if you have over 50 enrolled employees, and a completed census. That is all for our webinar today on minimum essential coverage solutions. If you have any further questions, feel free to contact either myself at the email address listed there, wes@sebohio.com, or AJ Santos, your dedicated service coordinator, at aj@sebohio.com, or you can visit our web address at www.sebohio.com. With that, we want to thank you for taking the time to learn about these minimum coverage solutions, and we look forward to talking with you again in the future. Thanks, and have a great day.